And finally, as last but certainly not least, the Commissioner of New Jersey's Department of Banking and Insurance, Stephen Goldman. He was sworn into that office on March 20th, 2006. Prior to his nomination by Governor John Corzine, Commissioner Goldman was a senior member and 22-year veteran of the outstanding firm of Sills, Cummis, Epstein, and Gross, where he focused on corporate law, focusing specifically on mergers and acquisitions, banking and finance, joint ventures, and leverage buyouts. Commissioner Goldman earned a Master's of Law and Taxation from the New York University School of Law, a J.D. from the George Washington University School of Law, and a bachelor's degree in political science from Boston University. He lives in Woodcliff Lake, New Jersey, his wife and 3 children. Welcome, Commissioner Goldman.
Good afternoon, Chairman Andrews, Ranking Member Klein, and members of the subcommittee. I thank you for giving me the opportunity to address you today. As the chief insurance regulator in New Jersey, I'm acutely aware of the crisis our country faces with regard to health insurance coverage. Of nearly 45 million Americans without health insurance in 2005, 8 million were children and 1.3 million live in New Jersey. But there is some good news because there is an increased level of engagement and innovation at the state level on health reform issues. Just in the past year or so, we have seen major legislation adopted in 7 states and reform work underway in 6 more. A fundamental principle of insurance is to spread the risk as widely as possible. That principle is undermined by the increasing segmentation of the marketplace into smaller and smaller risk pools. Therefore, a guidepost to New Jersey's reform efforts is the creation of larger risk pools. The Corzine administration has as a priority reducing the number of uninsured through a comprehensive examination of the current health care delivery system and its funding mechanisms. The administration's health reform strategy is to expand health coverage in 3 ways. Increase affordability and availability of commercial coverage for individuals and small groups. Expand Medicaid and family care to cover people for whom commercial coverage is unaffordable, and strengthen the existing system of reimbursing hospitals for uncompensated care. At present, this strategy does not require employers or individuals to purchase or contribute to coverage. A working group chaired by State Senator Joseph Vitale has outlined a plan that would reduce by at least 50% the number of uninsured by replacing the New Jersey individual market with a government-sponsored program that would be mandatory for all people not eligible for employer coverage or Medicaid. The plan would have premiums and other cost-sharing requirements based on income, so it should be affordable to every person required to purchase it. A major obstacle is its cost, estimated in excess of $1 billion, of subsidizing the premiums of low-income enrollees. The administration continues to share Senator Vitale's goals and to work with him on health care reform. These approaches probably require an assessment on both insured and self-funded health benefit plans. Some argue that ERISA preemption precludes such assessments, which will leave the burden on insured plans only. In June of 2006, New Jersey, as part of the National Association of Insurance Commissioners, worked to identify promising state reform proposals and ways in which the federal government could encourage continued innovation and reform at the state level. As a part of that effort, the NAIC created the State Innovations Working Group and the Federal Relief Subgroup, which I co-chaired with Commissioner Steve Orr of Maryland. The groups gathered testimony from many sources and examined ERISA preemption and its effects upon state reform efforts. The subgroup conducted a survey of the states regarding potential preemptive effects of federal laws on innovations related to making health insurance or alternative health care financing mechanisms more affordable. One important issue noted was that ERISA complicates the ability of states to implement premium assistance programs as part of their Medicaid and SCHIP programs. Due to ERISA preemption, states cannot require employers to participate in these programs. States also find it difficult to obtain information about employer coverage because they cannot compel employers to report this information or inform lower-income employees about the opportunity to enroll in a public program. Thus, preemption undermines what would otherwise be a very effective strategy for helping working families afford the coverage already offered by their employers. Importantly, in several areas, the states believe they are not actually preempted by federal law, but uncertainty regarding what is permissible has created a threat of protracted legal action to resolve the question, and has effectively discouraged the states from acting in these areas. The NAIC used the results of the survey to formulate a 4-point proposal for federal action that would help encourage more states to undertake innovative reform measures, allowing them to act as the laboratories of democracy. We selected items for inclusion in the proposal to maximize flexibility to confer upon the states and minimize impact on sponsors of multi-state self-insured plans. New Jersey supports the NAIC proposals, and they're as follows. Adopt an amendment to ERISA clarifying that data collection requirements are saved from preemption. To minimize the administrative burden of this change, it would not be unreasonable to limit states to collecting the same information from self-insured plans that they collect from fully insured plans. 2, adopt an amendment to ERISA to clarify that pay-or-play requirements that are neutral as to whether an employer pays an assessment or offers health benefits and makes no requirement regarding the form of benefits offered to employees are saved from preemption.
Commissioner, if you could just briefly wrap up.
Yeah.
Thank
Amend
you.
ERISA to give the Secretary of Labor authority to grant waivers. And 4, create a federal grant program to provide qualified state startup and operating funds.